What if your loved one, friend, family member didn't have to pass away due to cancer? Most of us know someone that's affected by cancer, whether that's a family member, a friend, yourself. A lot of us worry about cancer being transferred to us through genetics, or the fact that nowadays they say everything causes cancer. So that's my cousin Kaylee, who is clearly affected by cancer in many different ways. My grandfather was also affected by cancer. He's survived colon cancer twice. And the second time, he has over 100 doctors around the world that were in the operating room with him because he had cancer and it actually grew out of his appendix and through a hernia, which caused his appendix to burst, which most people don't survive. That actually saved his life because if not, it would have completely ruptured his bowel. My cousin Kaylee, she had breast cancer twice, which she survived both times, and then brain cancer that ultimately ended her life. So my topic is just that there are many different treatments out there that most of us don't know. Most of us know that of radiation, chemotherapy, and there's actually a lot of other options. So the first one I'm going to talk about is Cancer, which is a treatment that was founded in Germany, and it targets the inactivation of stem cells. So it's used after radiotherapy, and if you don't have stem cells in the cancer cells, there's no growth. So at that point, the radiation only has to target the cells that are already there. So this was founded by new RX correspondents, and it uses a biomarker which attaches to the cell, and then when it's scanned, it tells you like the best time to actually attack the stem cells and when they're dividing at their weakest points. And they use subclones to detect that timing, and once the optimal timing is targeted, it'll destroy the cells. This is extremely personalized, which is something we do personalize a lot of cancer treatments, but not to this extent. Like the amounts of chemotherapy and radiation or the different types are really personalized, but this is taking it to a whole nother level. So next, there's another more kind of complex version of a cancer treatment, which this also targets the cancer stem cells, which kind of explains that in conventional cancer therapies, so if that's your stem cell and then your other cells growing around it, it targets the blue ones first, which leaves the stem cell there at the end when they think that they've almost cured the tumor, and then it just relapses. Whereas with specific stem cell therapy, it targets the yellow one first, which is your stem cell, and then the tumor regresses and ultimately the cancer is cured. So with the second one, they use plasma and ultraviolet radiation. So that's a mixture of nitrogen and helium gas into a high voltage electrode, which creates the radiation, which is safer than the typical forms used today. A researcher at Drexel University found this, and it's personalized by a controller that when they target each area of where cancer affects the body, it determines a specific amount of plasma and ultraviolet radiation that is needed to kill that specific tumor. So again, it's way more personalized than anything we typically use today. A lot of these are found outside of the US, and a lot of people don't do their own research to see that these are out there, so it just kind of takes it to a whole nother level. So lastly, they're like in a more generalized form, when people are looking to cure cancer, they don't typically look at they look at what's causing it, but when something causes cancer, they don't look at the cause of it anymore. They just look at curing the cancer. So a researcher at a university in Bologna found that a more generalized approach, so they found it using cyanotic liver. So that's the cycle of liver damage. So it causes excessive scarring that blocks the flow of blood to the liver, which causes the liver to deteriorate and eventually causes liver cancer. Now, once this disease started causing liver cancer, they weren't focusing on the disease anymore. They were only focusing on getting, the cancer cured, which was just creating a vicious cycle between the end stages of the liver damage to cancer. Because by the time they got their focus back on the actual disease, it was already too late. The liver was already dead and they needed a transplant anyway. So they decided that if they took this approach with tackling equally both the disease and the cancer, that it had a more positive outcome. So that kind of sums up what I was saying, but in conclusion, that there are many options for cancer. And I'm not saying that doctors are wrong by any means. You should always listen to what your doctor has to say, but it should also be taken in consideration that you can do your own research, you can look at your own plans, you can bring things up to doctors. There's always experiments and stuff going on that many doctors don't bring up because they're not proven to definitely work, but they have really good outcomes. It just takes 10 to 15 years at least for them to even be an option. So there's far more than just these 3 options. Those were just the ones I focused on. But if your loved one is affected by cancer, you should probably consider doing your own research.
Okay, thank you.